Kwadcast Nation, as usual, we're bringing the heat today. We're bringing on Dr. Staci Whitman. I like just talking to her beforehand, all the accolades already with the DMD, functional medicine, starting their own accreditation from a functional medicine and dentistry side of things. This is really exciting to have you on board, and a fellow eudaimoniist. How do we call each other?
Yes.
What do
Ooh,
you
I
call
like
each other?
that. Eudaimonious. Yes.
Oh, but Stacey, welcome on the show.
Thank you so much, Kwadwo. It's a pleasure to be here. I'm excited to talk about oral health and we'll get into it.
Absolutely. So, I mean, where to start? I think people don't fully appreciate the links between oral health and how it impacts your overall health. So maybe just let's start at a high level. Like, why should we care about our oral health?
Yeah, it has been ignored. I think, part of the problem is how we've compartmentalized the body, and it's beyond dentistry, certainly. But if you look, we have body doctors, and then we have these special doctors that take care of our mouths and teeth, and then other special doctors that take care of our eyes. Like, it just doesn't make sense. And then the insurance companies follow suit. And so it creates this mindset shift in patients that it is separate, okay, that the mouth is separate from my body. And as a result, it's an afterthought. And we've tend to normalize things that we shouldn't. And so cavities and gum disease are the top chronic diseases globally in all age groups. And by the time you're an adult, up to 90% of people have experienced some form of gum disease. And, 60 to 75% of people have cavities, but we just think, it's just, I'll get them fixed at the dentist. But these aren't normal biological processes. Ancestral humans didn't have decay like we do today, and they didn't have gum inflammation like we do today. And so my job and my passion is to empower people to take control of their oral health, because your mouth really is the gateway into your body. And it is where we can see nutritional deficiencies in your body before they show up or manifest in other ways. We can see gut health issues. So if you have oral ulcerations, geographic tongue, these things, the mouth is the gut. We forget this, but it's the beginning of the alimentary tract. And so what happens in the mouth doesn't stay in the mouth. And so if you're a provider or even a patient who's trying to get gut health under control and you're missing the mark, has anyone looked upstream and talked to you about your oral health? But we also know too that how our oral health manifests can influence things like our brain health and our heart health and our fertility and autoimmune diseases and cancer risks and things of this nature too. So it's a big deal. And so we're trying to get the mouth back into the body and have it part of the conversations when we're talking about health and wellness and longevity, that oral health matters too.
You bring up good points about your oral health, your mouth being part of your GI tract. It's showing you signs of poor nutrition and so forth. So you can get almost like an early warning system from your mouth. But what do we do about it is my question. Like if we are seeing some of these issues, is it just a matter of optimizing our nutrition? Is it what we're making sure we brush our teeth and use the appropriate mouthwashes? What do we actually do about it to enhance our health?
Yeah, it's complicated because we're all bio-individual. And so the reasons behind it can vary depending on the person. And this is where I think dentistry's missed the mark, is we've standardized everything, and it's just, it's floss and brush and avoid sugar and use fluoride and you should be good. But we know that's not the case. If these things worked, why are these diseases still some of the top diseases in the world? And a lot of it has to do with our modern food landscapes. Ancestrally, we were foraging, we were hunting and gathering, we were eating more of a paleo diet, if you will. And I'm not here to advocate for any certain sort of diet, but we did, if you look back at ancestral skulls, you'll see they really didn't suffer from dental decay or dental disease. When did this change happen? It happened around the agricultural revolution and then the industrial revolution, where we started milling and processing food and stripping out nutrients. And now everything has sugar and flour and additives and preservatives. So a great place to start if you suffer from oral health issues is your diet. It's your nutrition. And it's not only what you're eating, but it's how frequently you're eating it. So we tend to overeat, and many people now know that's not great for your gut health, right? Your gut, the motor complex, the migrating motor complex, we need time to rest, we need time to digest. Well, your mouth does too. And we snack and sip all day long, and so we're not allowing our mouth a chance to stabilize and heal through our saliva is really what happens. So your saliva has minerals and enzymes and immune cells in them that can rebalance the microbiome and the pH. But with our modern diet, we don't allow its time to work. And it's not only sugar. I want people thinking that flour is like sugar in the mouth too. So it's the chips and the candy bars, but it's also the pretzels and the crackers and the granola bars and the protein bars, and some of the energy drinks are acidic. And it's just being aware of what you're putting in your mouth can influence your dental health too. So we always start with nutrition. I put hygiene very low down on the list, actually. I want to know how patients are breathing. So people who have mouth breathing issues, sleep apnea, dysregulated breathing, they will tend to have more oral health issues too. Because again, your saliva is there to protect your teeth, and it balances the pH, and it influences the mineral intake and uptake. But if you mouth breathe, you lose your saliva, your mouth dries out. That's why we wake up with this dry, sticky mouth in the morning, and that changes the pH, and it will change your microbiome in your mouth too, to be one that is more pathogenic in nature. So that's the next thing I think of with patients. Like, I want to know about your nutrition, and how are you consuming the foods you're consuming? How frequently are you? But also, how are you breathing? And then we do look at gut health. It's bidirectional. So if you have dysbiosis in the gut, you'll probably have dysbiosis in the mouth. So these are the more functional medicine perspectives that traditional dentistry doesn't speak of. And this is why so many patients, they go in every 6 months, and every time they go in, their gums are still bleeding. They're still getting cavities, is because no one's unpacked the true root cause reason. And they'll just say, use this mouth rinse, and I'll see you in 6 months. But it's not the products. Like, think of products like prescriptions. We want prevention over prescriptions, and prevention, yeah, right there. So the toothpaste and the rinse and all of that, those are things being marketed to us as what we need to stay healthy, but it's hogwash. I mean, yes, they can help stabilize us if we're in balance in some degree, but if you're truly in balance and you're eating well and you're mineral optimizing, you're vitamin optimizing, you're breathing well, you don't need all of these things in your medicine cabinet.
This is profound. I thought one of the first things we were going to talk about was, are you brushing frequently? I thought it was going to be along the lines of hygiene. But as you mentioned, like, I'm learning a ton here. By the way, I have two sisters who are dentists. I
You
can't wait for
do?
them. Yeah, I can't
That's
wait for
so
them to hear
cool.
this. The the ancestral information you just threw down. I always assumed that their hygiene was gonna be dank. I was like, if they weren't brushing their teeth back in the day and have access to toothbrush, I'm like, their dentition, their gums must have been horrible, awful. But it's interesting to hear that w- t- we're not seeing that same level of evidence of gum disease, etc. So it really does point out towards how we're feeding ourselves in the 21st century, which is,
Yes.
you know, ironically, we know it's not great for, like, when you have that much processed food, it's not good for every other part of your body. There's no reason to think it wouldn't be damaging to your oral health as well. So, are you finding then, Stacy, that the oral health is illustrating that you have issues, or is there any causation? Are we seeing any causation of, hey, you're starting to have gum disease, now you're putting yourself at risk of XYZ?
Absolutely. Yes. Yeah, I just want to pin this for a second. In the next time anyone goes to the Natural History Museum in New York City or in Washington, D.C., go look at skulls. They don't have decay and holes, and they're beautifully straight, and the jaws are wide, and the jaws fit together. There's no crowding. We're disevolving. And what other wild animal gets dental decay? The wolves don't, the lions don't. It's a very modern human diet. And I'll say our domesticated pets too, because of our food. Okay. And this is why hygiene is lower down to me. Now, this is like utopian perhaps with our modern society, but if you're eating whole foods, you shouldn't worry as much about your hygiene. Of course, I'm saying we need to brush and floss. I just put it further down. Okay, so let's talk about strategies and how to prevent systemic issues. So, what is happening when you have oral health issues? So, most of us have heard of leaky gut or intestinal permeability. Okay, that is, when the gut lining is imbalanced and there's openings essentially, and foreign matter can get in through the intestinal wall, and it can create a cascade of inflammatory responses, and that's just not good for the body. Well, the same thing happens with your gums. So I want everyone to think of the phrase leaky gums. So if your gums are inflamed and bleed, there is now a entry point for oral bacteria to get into the circulatory system, and they don't just stay in the mouth. They can travel all throughout, and they can end up in the heart, and they can cross the blood-brain barrier, and they can influence our sexual organs for fertility and pregnancy outcomes. They end up in our joints, so rheumatoid arthritis. And not only do the physical bacteria lead to an inflammatory response, but they release toxins in the places they end up. And these are called endotoxins. And that has a whole other cascade of issues too. So that can impact your blood sugar. So there are many bidirectional relationships that if you have gum disease and periodontal disease, you're more likely to have blood sugar dysregulation. And if you have diabetes, you're more likely to have gum disease. It links to dementia and Alzheimer's, where they've done studies where they've controlled for everything that you can possibly control for these patients that have passed away from Alzheimer's, and they found oral bacteria in the brain causing amyloid plaques and contributing to that. There's no reason oral bacteria should be in your brain. And fertility outcomes too, and pregnancy outcomes, miscarriages, and early birth rates and things of this nature too. So there are now 57 cross-linked diseases that can be tied back to a dysbiotic oral microbiome. And whether it's correlation or causation, I mean, there's still obviously more evidence that is needed, but certainly cardiac surgeons know about this. I mean, you have to be cleared from your cardiologist before they put stents in, or before you have joint replacements, right? You have to have your oral health cleared because they know that these bacteria can end up in places they shouldn't, like all the surgical sites they just did. So I just think there's a shift that we all need, and this really is the gateway. But it isn't just impacting your smile and your breath and your gums. It's impacting your entire system.
That's a powerful message, Stacy. It really is, because on our platform, we're always looking at ways to, like, things that are low lift that can have a significant impact on your health. And I mean, maybe it's not fair to say it's a low lift, but especially when you think about the ability to eat clean in 2026, maybe it's getting easier slightly, but it's still an uphill battle, in my opinion, especially if you have little ones. Like, I'm sure that, I bet my guess is we're seeing younger and younger kids with oral health issues, but it's just saw you shaking or nodding your head there.
It's an epidemic. It's a
Yeah.
global epidemic, yes.
Yeah, I mean, and that correlates with increasing diabetes, increasing metabolic issues in our youth. So I am saying it's maybe the solution is simple, but the means to get there is going to be challenging for a lot of people when it comes to the nutrition side. But I shouldn't have brushed over the breathing aspect either. Like, I just want to comment that this to me has been one of the most fascinating thing over the last 2 3 years. Really diving into the breathing, how that can affect, like, your jaw formation, your like everything when you're more of a mouth breather. So this is another one I think, Stacy, great to highlight for people. Maybe just to clarify before moving on, if you are a mouth breather, what are some of the approaches that you're a fan of to try and improve that scenario?
Yeah. Well, the First thing is just acknowledging it. Like some of us get a little defensive, like, I'm not a mouth breather, I don't snore, but you really pay attention to it. So either ask your partner, or if you live alone, do you wake up with drool on your pillow? Do you wake up with a really dry mouth and terrible breath? Do you wake up with brain fog? Do you feel really inflamed? Like, are you tracking your sleep scores, and what are your sleep scores like? So this all matters. Your quality of sleep can be influenced by how you're breathing throughout the night and shouldn't be ignored. It's not just stress. It's not just having a glass of wine before bed. I mean, it's also how you're breathing throughout the night. So the first thing to do, and this is, most functional dentists are airway trained. So it really is going to see someone to screen you and diagnose you, because again, it is so variable what your issue is. This is why I work a lot with the pediatric population. I want to fix any discrepancies in their jaws and their growth early while they're still growing. So we can do retainers and expanders and things to get them on track, because the jaws and the mouth is your airway. So it's not about a straight smile. It's about function, and that will last through your whole life. I don't want these kids on CPAPs, okay? So, but we need to know, like, why are you mouth breathing to begin with? Is it a bad habit? Is it a soft tissue issue, and that's muscle? Or your tongue is a muscle. So is it your tongue position? Is it the muscles of the face? Do you have a tongue tie or restricted tissues that are impacting things? Do you have enlarged tonsils? Do you have enlarged adenoids? Do you have just chronic inflammation in your sinuses so that you can't even breathe through your nose very well? So that's soft tissue. Then there's hard tissue. Is it your jaw alignment? Is it your tooth position? Do you have a deviated septum? How are you growing? Are you growing wide and broad, or did you grow long and narrow? And so these things all matter too. All hope is not lost if you're an adult to correct your skeletal issues and your dental issues. There are appliances for adults too, to be committed to this, but I'm a big proponent of getting your airway fixed, because I think nothing's more important than oxygen. Like we can talk about all the protocols and strategies, but you have to be oxygenating optimally. It's the only quote nutrient we can't live without for a couple of minutes or 3 minutes or so, right? It's critical. And it's critical for your how you're going to feel, and brain development and brain clarity and your microbiome, and we could go on and on and on. So the strategies I like, again, it depends. So if it's allergies, let's figure out, what are you reacting to? Is it environmental allergies? Are there food triggers? Have you had mold exposure? Do we need to do, a detox protocol on you? Is your bedroom like for sleep? Like, do you have a nice quality air filter? Is it a cooler environment? Are you drinking alcohol before bed and that's influencing your sleep, or a bunch of sugar or a bunch of inflammatory foods right before bed? Or do you have too much stress? So cortisol is going to impact that. If it's a skeletal or dental issue, this is where I recommend seeing someone trained in airway dentistry. And there's many different appliances you can use. People have maybe heard of lip taping or mouth taping too. I personally lip tape every night because my mouth does pop open at night when I sleep. A lot of it is a jaw alignment issue. I had a facial trauma when I was a kid, pretty significant. Mine would require very invasive jaw surgery to fix. I'm not going to do that. I can easily breathe through my nose without issue. So I'm comfortable taping my lips. It's just physically keeping my lips closed so my mouth doesn't pop open, and I breathe through my nose all night. Please get cleared by your dentist who's airway focused before you do this. If you have a true blockage in your nose, you don't want to be mouth taping. But so there's different things that you can do to get back on track. But the key is, don't ignore it, and go try to find at least a diagnosis and answers so that you can make a decision.
And plus, like, when you get this addressed, a lot of people will feel like a new person, a new individual.
Million bucks. Yeah, and you
100%.
might lose weight. Like, people lose
Yep.
inflammation, they lose weight, they get a little skip in their step again. Like, this is true reverse aging as far as I'm concerned, is getting your breathing and sleep. It's foundational. Like, I think we have to start there before we're adding creatine to everything and more protein everywhere. I'm just like, how are these people sleeping and eating or sleeping and breathing? So anyway.
Couldn't agree more. You alluded to this before, Stacy, but it's a topic that is completely foreign to me. Is this oral microbiome and what it means? Can it be manipulated? Is it a gateway into our overall health? Tell me, like I'm 4 years old, what I need to know about the oral microbiome.
Totally. Many different microbiome niches in our body, and the oral microbiome is the second largest, most diverse microbiome after the gut. I call them cousins. They communicate with each other all day. We swallow 2,000 times a day. So the bacteria in your mouth are translocating down to your gut all day long. So imagine if they're not healthy bugs, they're bad bugs. So the way I teach the kids that come to my office, I said there's good guys and there's bad guys. We really want to be nourishing and supporting the good guys more than we want to be focusing on feeding the bad guys or even wiping out the bad guys. If you have so many healthy bacteria in your mouth, it will crowd out the space for the bad bacteria. So we need to get away from the mindset that we want to carpet bomb the mouth with astringents and alcohol-based rinses and things. Just like antibiotics, just like, all the hand sanitizers and things we're using, a lot of traditional mouthwash, like strong astringents and things, it's carpet bombing the mouth. It can be wiping out the good bacteria too. We don't want that. So how do we support the healthy bacteria? What do they eat? They eat prebiotics and prebiotic fiber. So it's the same with the gut. So eat a rainbow foods, whole foods. I mean, this is it. It's whole foods. They want a wider range of foods. Fermented foods, will help as well. What the bad bacteria like to eat are fermentable carbohydrates. That's the sugar, that's the flour, that's the crackers and the chips and the pretzels and the granola bars and the fruit snacks and all of those things. So you really, if you nourish the healthy bacteria more, you'll be in pretty good shape. And then there's things that you can do too. Of course, there are prebiotic supplements and there's probiotic supplements and now there's postbiotic supplements and all of these things that we also use for the gut. They do have targeted formulations for the mouth. And then, you do want hygiene. This is where hygiene comes in. What hygiene is doing, it's removing the bio in your mouth. And for people that may not know that phrase, that's like a layer of bacteria, essentially. And we have biofilms all throughout our body. But what's cool with the mouth, we can access this biofilm very easily. I can't access the biofilm in my sinus that easily, or the biofilm in my gut or intestines, but I sure can in my mouth. And this is where we floss and we brush and maybe we tongue scrape. It's just disrupting that bacterial colony. If there are bad bacteria there, they can't sit there long enough against your gums, against your teeth, on your tongue to cause problems. And what problems can they cause? Bad bacteria, when they eat the flour or the sugar, their byproduct is acid. And it's actually acid that causes damage in the mouth. It's not the actual sugar or flour itself. It's the byproduct. It's acid. We know acid is bad in the body. It's low pH, okay? And so if we can keep a neutral or even slightly alkaline pH in our mouth, you're in good shape. You're not going to have problems. It's when it becomes acidic that we have problems. And unfortunately, our modern food landscape tends to make our mouths acidic, and all the drinks that we drink tend to be on the acidic side. So sometimes it's just realizing that this is the issue. It's like the pH of my mouth. And to your point, like I don't want it to be a heavy lift either. So what are some little strategies and protocols that you can do? Certainly I want you flossing and brushing. I do love tongue scraping. There's a whole different world of bacteria that live on your tongue, and the bad ones on your tongue can impact your nitric oxide levels, and this impacts cardiovascular health and performance and recovery and sexual health. So I do like some gentle tongue scraping, so that can help. Just warm salt water rinses with a little salt and baking soda. That's pretty low cost, no cost. You don't need to spend all the money on the fancy mouthwash. That will help neutralize and buffer the mouth. It has antiseptic properties to it. The baking soda raises the pH. It is magic. It really works. It's fantastic. Other strategies, like let's say we have kids, and they're eating goldfish crackers, which are my nemesis. I think it's one of the top reasons kids have cavities. I will point out, we send almost 250,000 children a year under general anesthesia to fix their teeth for a preventable disease. So it is a heavy lift there. Parents just don't know that the Cheerios and the goldfish and the fruit snacks are causing so many issues. And it's big food is to blame here. They're the villains in the room. But anyway, so if you can't get your kids off these, which of course I recommend to at least reduce their exposure, you can food stack. Like let your kids have the crackers first, but then offer a cucumber or a slice of apple or a carrot, because that chewing will dislodge some of those food particles that are feeding the bad bacteria that are going to release the acid. So it's just dislodging those foods. So have some water. That's a pretty good strategy. Cheese also, if you can tolerate it, will neutralize the mouth. So there are little things that you can do to tweak. But I really think the biggest thing is eating on a schedule. Try not to be a snacker. It's the snackers that get hit because you're constantly feeding the bacteria and you're constantly producing acid.
Fascinating. I'm learning so much here. I mean, we're used to be a goldfish family. Luckily, our kids are getting a little bit too old for that now. But the idea, Stacy, that I love hearing from you is these practical, pragmatic ways that we can overcome these things. So even the cucumber after the crackers, an example, salt and baking soda, which, as you've said, is going to be much cheaper than whatever fancy mouthwash. So it allows people to have that agency that and actually taking control of things in a realistic way. Because do you have kids, Stacey?
I do. I have two girls. They're 10 and 12.
Yeah, so you know about I mean, maybe you're a magic mom, but
No.
completely getting rid of some of this processed stuff is impossible in my opinion. Can you reduce it? Absolutely.
Yeah.
Like one of my philosophies is just minimize the stuff that's in the house because they're gonna get it everywhere else.
That's my
But
plus. I'm with you. That's
yeah,
exactly what I do.
like it's and kids are gonna be kids. Like I'm not never want to be the guy that says never can you have that stuff. But if we could minimize it, that is a big W.
And here's the thing I'll say, if your kids are exposed to these foods, which of course they probably are, right? And I'm with you. I try not to bring it in the home, but they get it at grandma's and soccer practice and they're bartering at school. I don't have control over this. So what do? You have great hygiene. This is where hygiene comes in. This is where you have to be flossing and brushing really well, especially at night, and then ideally brushing in the morning. People always ask me, what's the ideal hygiene routine? I would say, this is what I do. I tongue scrape in the morning and I brush. You could also floss. Sometimes I do floss, but I'm also a dentist, so don't take what I do. Let's be realistic. And then I like tongue scraping, flossing, and brushing at night. You have to be flossing. You have to be flossing. I prioritize it every night because it's these modern foods. So if you're eating any of the crackers, chips, pretzels, granola bars, your kids, the food gets wedged between your teeth, whether you feel it or not. It's there. And this is where we see cavities the most in kids. It's always between the molars, always. Because a lot of parents don't floss. We have prioritized brushing, but not flossing. I want to flip that. I think with our modern diet that flossing is more important because your tongue actually does a pretty decent job cleaning the outside surfaces of your teeth, but nothing gets in between. So that if I can ask and almost beg of all of you listening to just add one thing to your day, it would be flossing, please.
You're not the first person I've heard say that for sure. I'm just contemplating whether it was my sisters or not. Briefly, Stacy, I'm just curious then, like what's your life like? Because you're the dentist, you're active like in honestly in recreating and educating in the oral health space. What's your whether it's a day in the life or a week in the life, like what does your day look like with all these things that you're tackling?
Organized chaos. You know that. We all live the same life. I see patients now 10 days a month. So that has allowed me freedom to pursue other interests and passions, which is education. But I'm always working, essentially. I never say no. I answer emails and take meetings on weekends and in the evening. but I love it. I mean, I really love it. I hated dentistry. I hated it. I graduated and I was like, I cannot do this. I'm going to leave. I don't know what I'm going to do with all this debt, but I'll figure it out. And so I thought, well, how can I salvage this? It's actually why I went and became board certified in pediatrics, because it wasn't because I love children. I do love children, but it was because I wanted to get upstream. How do I prevent all this mess? These patients don't want to be in chairs getting root canals and crowns and oral surgery. Like, this is avoidable, but I got to catch them really early. And that's with children and their parents. So that's why I went back to school. But even then I was dissatisfied because now it's pediatrics. So it's higher volume. And I was even arguably worse off. So then I thought I need to think of this differently. And so I myself lived a cleaner life, but I wasn't implementing it into my day-to-day practice. And this is when I found functional medicine and I started learning functional medicine principles. And I have some naturopathic training under my belt too, and integrative medicine training. And I just kind of piecemealed it all together. And it's been incredibly satisfying from a career standpoint. But I knew I had to get out of my brick and mortar because patients were really responding and getting healthier. For the first time in my career, I was seeing patients come back healthier and they were hugging and they were so happy. And I said, well, this should be available to everyone. And the only way I can do that is through education. And so that is why I do work pretty hard, but when you do something you love, this is super cliche, but it's true. Like, it's not work. I will say fixing teeth is work. I don't like it. I do not like picking up a drill or a laser and fixing teeth. I love educating about prevention.
It's addictive.
It's addictive.
I mean, we're cut from the same cloth. Once you realize that you could catch people upstream and the impact that could have on their overall health, and then the people around them see the benefits and it's contagious. I really want to commend you for the amazing work, Stacy, and just being an outside the box thinker. There's a lot of people in the field of dentistry and oral health that aren't educating, aren't putting themselves on social, that are educating the masses because I was just actually I just wrote an article on this the other day on how what we learned in school about how to create change is a lot different than it is now. Like, it's not enough to just have that academic paper or write in that textbook. You need to be visible and you need to reach people in the way that they consume information. So yeah, I just want to commend you, Stacy, for the amazing work you're doing. How do people track you down? How do they consume the Dr. Staci Whitman, knowledge and so forth?
Yeah, please track me down. I am mostly on Instagram, _Stacy. We'll put it in the show notes. Doctor spelled out is Stacy with an I. I have a website, drstacy.com, spelled the same way. This is where I have articles. I have courses coming out very soon, like mini courses. I want things digestible. We don't have time for the 3-hour masterclass. I get it. And then I have a newsletter that I really love writing. This is where I do my deep dive. So I encourage you, if I try to cover every single little topic possible. And so please sign up for my newsletter. And I have other things cooking. I'm probably going to do a podcast pretty soon. I have a book
Feel it
coming
coming.
out.
I feel
So
it coming.
stay tuned.
Yeah, no, I feel you're natural on the mic. And so I feel like this is calling you, whether you're doing the solo versus interviews. I feel this is coming, Stacy.
Well, thank you.
Absolutely. Well, listen, thanks again for joining us. I've learned a ton. I cannot wait to circulate this bad boy to my parents, my sisters, and so forth. But yeah, thanks so much for doing this.
Sisters. I hope your sisters have them reach out if they have questions. I hope that they agree with what I have said.
You would love them. They're very much cut from a similar cloth, for
Oh,
sure.
let's hang out. We'll
I
meet at
know.
Eudaimonia because we're eudaimonious.
Because we're eudaimonians. I love it. Thanks again, Stacey.
Yeah, thanks, Kwadwo. Nice to meet you.